Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters, we are sitting down with Dr. Joy Bradley, an assistant professor of community medicine and population health in the College of Community Health Sciences. Today, we're going to talk about a food project that could affect Wilcox County. Thanks for joining us today, Dr. Bradley. So tell me a little bit about this food project.
So this project was initially funded by Robert Wood Johnson Foundation, and we wanted to work very closely with members of the community around food insecurity and food access, especially as it relates to childhood obesity and living in rural communities.
So how does the food project affect Wilcox County?
So we know that we'd like to increase the consumption of fruits and vegetables for young families and also everybody across the lifespan continuum. We also know that there are some cuts coming down the pipeline that are going to restrict folks' accessibility to food. And so it was really important for us to be thoughtful and actionable about the solutions that we could create to maybe buffer some of those things that are coming.
And I can't remember what you were saying, but you said it was double what going on in the United States?
Yeah, so the Wilcox County Food Insecurity Index is double the rate that the United States actually experiences. So when we initially approached the Black Belt Community Foundation, which were one of the three primary research groups that was working on this project, they immediately focused in on Wilcox County specifically. And so we wanted to make sure that we were being very intentional about doing this work in a city or a community that really needed it.
So how does this project work with the county?
So this project, we really interacted with a lot of community stakeholders. We had meetings with the county commissioners, and we also just reached out to some of the women in the community that were already doing this really important work. So people like the Bama Kids Foundation, and we also work with different community groups that are already doing this work in various spaces.
So what about this project will help them?
So again, it's really about increasing folks' awareness of opportunities to have access to healthy fruits and vegetables, and it also is really important to increase their overall access through opening spaces like the farmers market.
Yeah, I think that's what I was kind of getting at. How is this creating access? Where are y'all creating access points to, and how are y'all getting the food to them? Okay,
so we are definitely partnering with some of the local food producers in the area. We are also working to create opportunities for the community themselves to start their own container gardens and to use that opportunity for them to be able to sell the excess produce that they produce within the farmers market, so that they can also, use that as an economical kind of moment to generate more income for their families.
So why are we seeing this take place in Wilcox County? Because I know in Alabama we love to say we're an agriculture state, so why would we be seeing this in a county?
So again, I think traditionally we've understood food insecurity and food access issues around like grocery retail. And so I think this is an opportunity for us to kind of think outside the box a little bit. We're also working with some of the community gardens in the area, again, some of the local producers, and encouraging communities themselves to produce their own fruits and vegetables as a way to increase the intake of fruits and vegetables overall.
So what will be the next steps for this project?
So the community is also interested in doing a little bit of work and implementation around food as medicine. And food as medicine is really focused on working with local providers, whether they be physicians or pharmacists in the area, to write out prescription scripts for families to go and get access to fruits and vegetables as a way to maintain their overall health and wellness.
And are y'all planning to expand at all or to see yourselves in different counties?
Oh, absolutely. I think some of the other counties, once they kind of heard about our project, they are very, very interested in duplicating their efforts to make sure that this is something that can be taken advantage of across the Black Belt.
Yeah, that's going to be my next question. Is this something that we are just seeing across the Black Belt, or is it kind of all over?
We're definitely seeing it across the Black Belt because those are some of the more rural spaces. And again, the ways in which we traditionally understand food insecurity is it's really centered around like access to a grocery retail. And the reality is for a lot of the Black Belt communities, there is one central grocery store that may serve the entire county. And so it's time for us to kind of think outside the box and kind of thinking about what are some of the ways in which we can produce and create access points for our community members to take advantage.
Yeah. And this is just kind of my own personal question, just hearing you talk about it, because it seems to be a lot, but is it also difficult for them to farm there? Sometimes I hear that they have like a low pH system in general. So does that make it kind of doubly hard to get things around?
Well, actually, one of the reasons why the Black Belt is named the way it is because of the richness of the soil. And so they don't necessarily have that issue, but I think it's just an overall, I think we were talking about this earlier, is there's an issue around the idea of farming itself. And even if you just have something as small as a canister garden or just a small space, it provides an opportunity for you to kind of grow your own fruits and vegetables even within that small space, and to not necessarily think that you need an acre of land, right, to kind of provide for your family.
Yeah, absolutely. So is there anything that I haven't asked you?
So I think it's just really important for everyone to understand the connection between access to healthy fruits and vegetables and what it can mean for their overall health. As we all know, we experience higher numbers of diabetes, obesity, heart disease. And so when you consider things like the Food is Medicine initiative, it's a way to help people better understand from a holistic perspective, how can they empower themselves to how to take charge of their own health needs.
Yeah. Does it give them kind of more of a balanced diet?
So it's not as, well, yes, it gives them more of a balanced diet, but again, it also helps promote the idea that, I can, contribute to my health in a very empowering way. And so and that leads me to just another aspect of this program is the educational piece, right? And so not only do we need to do a better job of educating people about, how certain fruits and vegetables can impact their health, but also how to cook those fruits and vegetables, right? And because a lot of people, they're interested in eating more healthier, but they don't know how to prepare the foods. And so working with the County Extension Service, which already, they do a fantastic job of doing like food demonstrations and cooking demonstrations. And so just working with them and partnering with them. And we've had them, come to the farmers market specifically to do some of those food demonstrations and cooking demonstrations so that people can, make the connection between buying the healthy foods and actually eating and preparing them.
Well, thanks for joining us today, Dr. Bradley. That was very enlightening.
Thank you for having me.